A growing number of women are turning to suicide prevention services in a shift that the charities are labelling as deeply concerning. Data from the Office of National Statistics show that there's been a 32% rise in female suicides between 2012 and 2022. Our health correspondent Ashish Joshi has this report and a warning this story contains references to suicide.
Emma knows all too well the grief that suicide brings. Her sister Lou took her own life, and so too did their grandmother. Emma's father tried too.
The cycle of grief was immense and deep. It's not straightforward when someone takes their own life. The anger, the disbelief, the constant searching. There must have been evidence, there must have been something we could have done, there must have been a note, there must have been something. And then the anger, I think, around, weirdly, other people, people don't know what to say or do.
After years of decline, suicide rates are rising, especially among women. In 2023, in England and Wales, they reached levels not seen since 1999. Suicide data is complex and can be quite hard to interpret, but the latest government figures do suggest suicide rates are at their highest. This figure has been disputed for being oversimplified. But what is indisputable is that far too many people are taking their own lives, and that this is a public health crisis that needs urgent intervention. The government has promised to tackle suicide, including the recruitment of over 8,000 new mental health staff. Suicide prevention charities are seeing a surge in the numbers of women seeking help.
We've got that middle-aged group of 45 to 64 who are the sandwich generation. So they might be juggling caring responsibilities, working and childcare. And then on top of all of that, you've got some really big risk factors for women. So menopause and perinatal period, domestic abuse.
This is my sad lamp. This is something that I use over the winter to help me stay well.
Olivia has been trying to take her own life since she was 12. A difficult childhood, years of mental health crises, and the dark winters, all factors.
There are more attempts than I have been able to count, and they were quite different in, I guess, the lead up to it. Some of them were very, very impulsive, maybe in response to a certain trigger or because I'd been sort of misusing alcohol, whereas others were a lot more premeditated.
Olivia is in a much better place now, but that doesn't mean her struggle is over. It's always there. But she can tell when things get too much and she can reach for help. Tragically, it's not the same for thousands of other women. Ashish Joshi, Sky News.
And if you've been impacted by anything that we've talked about there, you can contact Samaritans for free on 116 123 or email them at joe@samaritans.org.